too many people don't realize that there are a lot of value-based care opportunities under a fee-for-service umbrella. There are numerous fee-for-service programs out there that support a value-based care model. The chronic care management program, remote patient monitoring programs. There are annual wellness visits. You can support care transitions through fee-for-service. You can support behavioral health through fee-for-service. There's a lot out there under a more traditional fee-for-service structure that you're getting paid for the service that you're rendering. So there's an opportunity to support a transition to a more risk-sharing based payment model, and then get yourself more familiar with value-based care concepts and operations under fee-for-service before you make that transition. I think people feel like they're falling off a pretty steep cliff if they have to move into the value-based care world, and it really doesn't have to operate that way.